Hi, I am Dr. Arsalan and today we are going to solve the MCQs on circulation. The first question is, the tunica intima of the blood vessels is made up of dash. Given options are muscles, epithelium, connective tissues or all of these. First of all, we should know that the study of blood vessels is called angiology. Layers of the blood vessels are called tunica. There are three layers of the blood vessels, the external, middle and internal layer. The external layer is called tunica externa, the middle layer is called tunica media and the inner layer is called tunica intima. Here the composition of tunica intima or innermost layer of the blood vessels has been asked. So it should be kept in mind that external as well as the internal layer of the blood vessels, it is made up of epithelium, while the middle layer, the tunica media, is made up of muscles. The epithelium which constitute the tunica intima or internal layer of the blood vessels is also called as endothelium. So the most appropriate option would be the endothelium, but here the endothelium is not present, so we'll click the epithelium option in this case. Next question is, cardi tendini, these are present in the dash. Given options are pleura, pericardium, arteria, cardiac valves. The cardi tendini, these are the fibrous muscular bands which connect or join the heart valves, mitral valve and tricuspid valves to the valves of the heart or muscles of the heart. So these are present in the heart valves. So the option D is correct, that the cardi tendini are present in the cardiac valves. The other options, pleura, it is the outer cover of the lungs, pericardium is the outer covering membrane of the heart, arteria are the upper chambers of the heart or the receiving chambers of the heart. Next question is, there are dash valves in the heart. Now he is asking about the number of valves present in the heart. The given options are 1, 2, 3 or 4. As you know that there are 4 chambers in the heart. The upper chambers are called arteria, lower chambers are called ventricles. The arteria and ventricles, these are separated by 2 valves. The left arteria and left ventricle are separated by the mitral valve or bicuspid valve. The right arteria and right ventricle are separated by the tricuspid valve. The third valve of the heart is present in the aorta, arising from the left ventricle, while the fourth valve of the heart is present in the pulmonary artery, arising from the right ventricle of the heart. There are 4 valves in the heart: the bicuspid valve, tricuspid valve, aortic valve, pulmonary artery valve. So the option D is correct, that there are 4 valves in the heart. Next question is, the circular smooth muscles are present in dash. Given options are tunica externa, tunica media, tunica intima or none of these. I have told you earlier that there are 3 layers of the blood vessels: the tunica externa, tunica media and tunica interna. Tunica is basically the layer of blood vessels. So tunica media, it is made up of smooth muscles, the circular smooth muscles, which have been asked in this question. So the given option B is correct. Tunica media is made up of circular smooth muscles. Next question is, nasal tube is used for. Given options are feeding, breathing, nasal obstruction or nasal stenosis. As you know that the nature has gifted us with the pharynx, which serves as dual passageway for both food and air. So in case we cannot ingest food by mouth, for example if the patient is lying in coma or there is mandibular fracture or the fracture of jaw in which the person cannot chew food or cannot ingest food, so the surgeons pass nasal tube in which the food is administered in the nasal tube and it travels from the nose, pharynx to the digestive tract via esophagus and stomach, bypassing the respiratory passageway of the larynx, trachea or bronchi, etc. So the surgeons keep the patient on the nasal tube for feeding. The nasal tube is used for feeding of the persons. Next is, the tiny vessels join to form dash. Here the tiny vessels means the capillaries or the blood capillaries. Capillaries meet or join to form dash. Given options are capillaries, arteries, veins or venules. So it should be kept in mind that the aorta arises from the heart, the left ventricle of the heart. It branches into the arteries, then arterioles, while arterioles split into the capillaries. The exchange of materials between the capillaries and cells occur here. So there is the exchange of materials by means of diffusion. Thereafter the capillaries, the tiny blood vessels, these join to form venules, venules join to form veins, veins join to form vena cava, and vena cava again lead to the heart, the right atrium of the heart. So the tiny blood vessels are the capillaries, these join to form the venules. So the option D is correct. Next question is, the characteristic lubbed up sound of the heart, it is produced due to closure of dash. Given options are ventricles, mitral valve, semilunar valves or tricuspid valve. So it's a very technical question, that the lubbed up sound can be heard by stethoscope. It is produced due to closure of the heart valves. So the question arises here, that which kind of valves are responsible for production of the lubbed up sound of the heart. As we know that there are 4 kinds of valves in the heart: the bicuspid valve, tricuspid valve, the aortic wall and pulmonary artery wall. It should be kept in mind that the pulmonary artery wall and aortic walls, these are also called as semilunar walls, and the lumped up sound of the heart, it is produced due to closure of the semilunar walls or the aortic and pulmonary artery wall. So the option C is correct, that the lumped up sound of the heart is produced due to closure of the semilunar valves. Next question is, there are dash pulmonary veins. Given options are 1, 2, 3 or 4. Asking the number of pulmonary veins. Pulmonary veins arises from the lungs carrying oxygenated blood to the left atrium of the heart. You know that there are two lungs present in the human thorax or chest cavity, and each lung gives rise to two pulmonary veins. The two pulmonary veins arise from each lung. Total there are 4 pulmonary veins which arise from the both lungs and supply oxygenated blood to the left atrium of the heart. So the option D is correct, that human beings have 4 pulmonary veins. Next question is, the blood pressure is measured by. He is asking the measurement of blood pressure in human beings. First device is pulse oximeter. It is used to measure the pulse and oxygen level of the body. The sphygmomanometer, it is used to measure the blood pressure of the human body. So option B is correct. Thermocouple, it is used to measure the temperature of insects or lower animals. Thermometer is the device which is used to measure the temperature of the body, used in humans as well as the animals. So the blood pressure of the human body is measured by the sphygmomanometer. The oxygen saturation of the arterial blood is, given options are 40 mm of mercury, 45 mm of mercury, 95 mm of mercury or 100 mm of mercury. So the blood present in the arteries is oxygenated, it's highly saturated, and its saturation level is 95 mm of mercury. It's a constant value and fact based question. Next question is, the systolic blood pressure is measured in arteries while diastolic blood pressure is measured in dash. Systolic means the blood pressure which is measured during the contraction of the heart, and diastolic means when the blood pressure is measured during relaxation of the heart. And we know that the blood pressure, it is 120 by 80 mm of mercury. The 120 is systolic, the blood pressure during contraction of the heart, and 80 is the diastolic or blood pressure during the relaxation of the heart. So both of the blood pressures, whether it's systolic or diastolic, both are measured in the arteries. Because pulse is present in the arteries, our heart pumps blood into the arteries, while veins don't have direct association with the heart because blood flows in the vein due to skeletal muscles massaging or contractility, and there is no direct association of the heart with the veins. So no pulse is heard in the veins, blood pressure in veins is very much low and can't be detected by sphygmomanometer. So both of the blood pressures, systolic as well as diastolic, these are measured in the arteries. So option A is correct. Again we are reproducing here that the systolic blood pressure is measured in arteries while diastolic blood pressure it's also measured in arteries. So the correct option would be arteries. These were some important kind of MCQs related to the circulation or blood circulatory system. Hope you'll find great knowledge in these MCQs in solving your MDCAT papers. Thank you.